The Center for Persons with Disabilities, known as the CPD, has been Utah's hub of services and resources for people with disabilities for 35 years. Approximately 65 CPD programs currently operate throughout Utah and across the nation as part of a national network focused on improving life for people with disabilities and their families. The CPD is one of 67 entities now known as University Centers for Excellence in Developmental Disabilities, or UCEDS, which operate under the Administration on Developmental Disabilities. Originally created in response to John F. Kennedy's National Commission on Mental Retardation, 19 facilities were established at public research universities across the nation. All but one of the new centers was linked to medical schools. The center at Utah State University was the exception.
The University Centers of Excellence were significant with the mission of doing research, training people who would be serving the needs of people with disabilities, and of course doing some exemplary type services.
That legislation was a landmark in terms of representing a shift from serving people with disabilities in institutions to moving toward including people with developmental disabilities in the community. The Disabilities and Bill of Rights Act recognizes that people have to function in inclusive settings in all aspects of life. Everyone needs transportation, health care, education, recreation, and employment.
The CPD, originally called the Exceptional Child Center, chartered new territory as it grew and programs expanded.
There were 19 of these University Centers of Excellence established between 1962 and 1968. It was interesting because it was very different than the others. The other 19 centers were all located at major medical centers. The grant application that was submitted here was for a center that would be not in a college of medicine, but in a college of education. And it would be rural, and it would be multi-state. So the mission of the CPD was very different. And I think it was just enough that it caught the attention of the people reviewing these applications, and we always say they had some leftover money. So they gave us a little bit to go ahead and start a program here.
The Center for Persons with Disabilities began, of course, as a university-affiliated facility, and I think owed its success to some visionary, dedicated, creative, hardworking people. These visionary leaders started out with this vision of services and then began to see that services needed to be provided not at the center, but in the community. And as the education unit moved out and those services were adopted by the school system and children with disabilities were served in the schools, that began a whole trend of activities that were inclusive and community-based. And now, of course, we've gone one step further, and we're saying we need to be supporting self-determination so that it's people with disabilities and the families who decide what services they need, choose what they want, and the notion is to promote independence, choice, and self-determination. And that's where the center is now.
Over the years, financial support for the CPD came from numerous and varied sources. During the past 35 years, CPD staff members have generated over $203 million in outside funding from local, state, and national grants and contracts.
Much of the support for the CPD came from state sources. Sometimes we got a little bit, sometimes we got a little bit more. And every time you go to the legislature, you have to tell them what you're going to use it for. And every time we got additional increase in state support to the CPD, there was an expectation. Probably one of the most remarkable things we did is when the parents of people with disabilities came and campaigned to the legislature for money to do autistic research. And Dr. Reed Warren's status in the state among parents was of such that they wanted him to pursue that.
I think the first impact that the CPD had was influencing service delivery. In 1972, there really weren't necessarily services for children and adults with disabilities, and the CPD provided a model for doing that. Now, what the CPD is doing is trying to partner with other agencies and organizations that provide supports and provide the technical assistance so that these community-based agencies can include people with disabilities in the services and supports that are available in general. On a national level, it was important that there be what are now University Centers for Excellence in Developmental Disabilities. The Center for Persons with Disabilities was instrumental in helping, first of all, to establish university centers in states that didn't have one, and then providing technical assistance to the centers that existed so that they would be effective in providing services, disseminating information, and providing interdisciplinary training and technical assistance.
As new technologies emerged, the CPD continued to grow, developing dynamic research, training, and service delivery projects on local, national, and international levels.
One of the things that's always intrigued me is, and I don't say this was by design or planning, it was probably more by survival, but the number of different type of projects. The CPD did everything. I mean, we were writing grants in every dimension of disability. Any source of funding that would help, from recreation to the Forest Service to BLM, any source of money, military source that we could get to support some of these programs. I believe right now there are over 70 individual programs, individual projects that have their own funding source.
My vision of the future for the Center for Persons with Disabilities is that we will increase the leadership of people who experience disabilities. We obviously, as those of us who've been at the center are starting to get gray, need to be thinking about the new leaders that we're mentoring and the increasing representation of people with disabilities and people from diverse cultures.
As we look at the future, I don't even think it's on the horizon, the changes that are going to occur. We know that technology is going to change. We know that there's going to be some gene splicing and gene engineering and things like that. Those are on the horizons. But there's things that are on the horizons that we don't even think about now that are going to come up within the next maybe even 5 years, 10 years. But the CPD is positioned because it's got its fingers in almost every funding source, almost every dimension of society that is needed to support people with disabilities. And the future is as bright as it can be.